A cripple on his deathbed in a daydream did ride, or past the streams of fire on a pedal path did glide. He left his wheelchair spinning deeper.
You summarize your healthcare priorities.
The primary difference between the Freedom Party approach to these issues and the approaches you'll hear on the rest of the table here is that whereas the rest of my colleagues or friends here are telling you how they would save the system or strengthen the system, Freedom Party's focus is, instead of saving the system, saving the patient. To do that, we have to make sure that the patient's concerns are the ones that are addressed by healthcare providers, not the concerns of elected politicians who are concerned about defending unions, who are concerned about defending politicos, and etc. That is not the right thing to do to the healthcare system. But right now, the healthcare system is forced, because the government is holding the purse strings, to respond to politicians' concerns first, and if they can still do so, then to respond to the needs of patients. Freedom Party's approach is this: restore to patients the power of the purse. Give them the power to say, I want to choose OHIP, or I want to choose a private insurer, or I'm young and I'm healthy and I want to pay as I go for now and I'll think about buying health insurance later. I know that sounds very different than what we have. It's in fact what we had before the Progressive Conservatives changed everything in 1968 and banned private insurance and introduced a brand new tax, the provincial income tax, to pay for the OHIP monopoly. We're saying, don't get rid of OHIP, but introduce some competition so that OHIP puts the concerns of the patient first instead of putting the concerns of elected politicians first.
Thank you very much. Our strategy, I have to tell you, is all laid out. It's on the website, and I urge all of you to go to the website for the various parties and read more about this. But in 2 minutes, here's what I'll tell you. We're going to continue to build on the progress we've already made on wait times. We're going to continue to drive down wait times in the 5 key procedures we've already identified, and we're adding 3 more. Pediatric surgery, general surgery, and the biggest challenge of all, emergency room wait times. We're going to increase the number of Ontarians who have access to a family doctor by another 500,000 people. We've already increased the number of Ontarians with family doctors by 500,000. We're going to increase it by another 500,000. We're going to add 100 new spaces to medical schools to increase the number of doctors practicing. And we're going to add to the 150 family health teams that we already have by another 50 family health teams. We're going to hire 9,000 more nurses, the backbone of our healthcare system. And we're going to continue to work towards meeting our goal of 70% of nurses working full-time. We're going to introduce 25 nurse-led clinics in hard-to-serve, difficult-to-serve areas. A very big focus that we're going to take over the next 4 years is providing better supports for seniors so they can age at home. It's better for seniors, and it's also better for the system. If people can stay at home with the supports they need, let's provide those supports so they can stay at home. We've attached $700 million to that plan over the next 5 years. We're going to increase the number of oh my goodness, I'll have to wait till the next chance I get.